I'm Alfred Cutner. I'm a consultant gynecologist who specialises in laparoscopic or keyhole surgery. I predominantly treat two main areas. One is endometriosis and the other is urogynecology. Endometriosis is a condition where there is lining of the womb outside the womb. It can cause pain, painful periods in particular, and fertility problems. The other area that I treat is urogynecology conditions, which are conditions of problems with bladder or prolapse. Prolapse is a condition where there is a weakness of the supports of the womb, and traditionally people will be offered a hysterectomy, whereas nowadays there are more choices, and operations such as keyhole surgery to lift up the womb may potentially lead to better long-term outcomes, but in particular will lead to a faster recovery and gives patients more choice. Well, I'm known for keyhole surgery, and that is my expertise. And keyhole surgery is surgery carried out through small holes. So instead of a big cut in the tummy to look inside, there's a small incision in the tummy button where the telescope goes, which gives a magnified image on a television. And because it's an enhanced image, in many ways it is more accurate. It allows us to develop new surgery, and the main advantage for the patient is their quicker recovery afterwards. Well, often I'll see a large amount of patients with endometriosis, so we would run through the symptoms they're complaining of. We would determine whether or not it is a fertility issue or a pain issue. This is the cyst of the ovary. So one of the great advantages of doing advanced endometriosis surgery at the Edward VII Hospital is we have an accredited endometriosis centre. And to be one of these centres, we need to work with named specialists in a multidisciplinary manner. We have Sabina, who's our nurse specialist. We work with Mr. Al Windsor, who's one of the colorectal surgeons here. We work with Mr. Rizwan Hamid, where there's urological input. We work with Andrew Baranowski, where there is pain management issues, and therefore being treated in a centre is quite important with women with severe endometriosis, so the best decisions can be made with them to lead to the best outcomes. When they come in for their surgery, they'll have their operation carried out in a state-of-the-art integrated theatre, and the Edward VII has invested in the latest equipment. And then when they go to the wards, they'll find they have great care.
Hello. Hi.
What is special about the King Edward VII Hospital is that it offers old-fashioned care with state-of-the-art technology. It has state-of-the-art theatres, state-of-the-art equipment, it has an intensive care unit, but it is old-fashioned in the fact that it has a very high nursing ratio to patients, and it truly cares for the patients that it looks after.